The New York State Office of Addiction Services and Supports, or OASAS, provides this podcast as a public service. Thoughts and opinions expressed do not necessarily represent or reflect those of the agency or state. For more information on services and supports available, go to our website oasas.ny.gov. If you or someone you love needs help, call the New York State Hope Line any time of day or night. 1-877-8-HOPE-NY. This is Addiction, the Next Step.
Welcome to Addiction, the Next Step. I'm your host, Jerry Gretzinger. Addiction of any kind is not something that's easy for anyone to overcome by themselves. And that's why there are literally hundreds of state-approved treatment providers and facilities across New York State, including a dozen specialized addiction treatment centers directly operated by the Office of Addiction Services and Supports. Now, these are residential facilities that have been changing lives for New Yorkers at every corner of the state, and all of them focused on long-term recovery.
And we are talking to Vivek Velez, who is the director at Kingsborough Addiction Treatment Center. And we've also got Steve McLaughlin on the line with us today. He is coming to us from McPike. And thank you both for joining us on the podcast.
Thank you for having us.
Thank you for having us.
Yeah, absolutely. And, everything that we're sharing on this podcast, I think, is so important because certainly you can never saturate New York State with enough information about the services and the supports that we provide. And, I think people just they're not as aware as they should be of the fact that OASAS has addiction treatment centers that it operates. I mean, this is something that we provide to the citizens of New York State. So let's start, and both of you jump in as you feel necessary, or, you have something to add in there. But just tell us, what happens at addiction treatment centers? Tell New Yorkers, what do we do there?
Sure. So, once again, my name is Vivek Velez. For the treatment program, addiction treatment programs, we have them all over New York State. And one thing that and I'm sure Steve will agree, that you will receive the finest treatment, the best services. Our staffing is diverse. We have evidence-based groups. We provide medication-assisted treatment. But ultimately, you'll be able to experience quality services at its best from the state itself.
I echo that. I agree 100%. I believe the way the ATs operate, we're a no wrong door. So you come to us, even if we can't, fit you into the program, we'll get you to where you need to go. Insurance doesn't matter. We work with individuals however long you need to stay. The continuing care piece is top notch, getting the individuals where they need to go. The bed-to-bed, door-to-door, those types of programs help, and we offer that at the ATC. We also we could do co-occurring services as well, because majority of the 12 have a psychiatric prescriber. I know myself at McPike, we have 2, so we can offer those types of services as well.
Now, you know what I'm going to do, too? I want us to back up as much as we can, too. Like, I was thinking, for most people, inside OASAS, we say ATC. We immediately know what that means, ATC, Addiction Treatment Center. So I just want to make sure people know, if you hear ATC, that's what it stands for, Addiction Treatment Center. But then, Stephen, you also said co-occurring, right? You said co-occurring. Let's bring it down to the basics. What do we mean by co-occurring? Explain that to people and how that can be treated at the ATCs.
Sure. So the individual that comes to the facility that has a co-occurring substance abuse disorder and a mental health issue, whether it's diagnosed or has not been diagnosed yet, there's integrated care that can be provided to the individual where they get the prescribed medications that they need to treat their mental health issue. Which will help bring the brain to the table, because most of the services that we offer at the ATCs, whether it's cognitive behavioral therapy, motivational interviewing, those types of things, that's all talking therapy. So if it's a talking therapy, the brain needs to be present. And a lot of times people who are having a mental health issue or something going on, with their mental health, whether it be depression or anxiety, their mind's racing. They can't bring that brain to the table to be able to apply the cognitive behavioral therapy activities or listen and reflect on the motivational interviewing techniques that are being used. So if you come to us with those types of issues, you could be assessed by either the doctor or the psychiatric prescriber. Some of us have licensed social workers that can also help with that issue as well. So if you're coming with those two issues to the facilities, we could treat you at the facility or get you put you in the right direction to be able to alleviate some of those symptoms.
Yeah, I just want to add to, because everything that Steve mentioned was actually perfectly said. Just adding some piece to that, one thing that we try to stress to the community, folks who are referring individuals to us, or even self-referrals at that, is that we actually provide person-centered, individualized care. So we do understand that it's not a cookie-cutter kind of system. We work with the individual. We train our staff, from our social workers that Steve mentioned, as well as our CASACs, our social workers, everyone. We provide a level of training that provides, that educates them on how to pretty much provide like certain screening tools, such as the trauma screening tools, and be able to provide evidence-based groups, such as trauma groups, for our individuals coming in with co-occurring disorders. Because one thing that we have realized is that many individuals do come in undiagnosed, and they work with their counselors, they work with our full-time staff that are inclusive of psychiatrists in many ATCs, including mine, which is Kingsborough, inclusive of our NPs. So they work with those individuals pretty much, and it could potentially, for some, can be on a daily or weekly basis, to ensure that they are getting the best care while they are here. In addition to that, because this is short term, our two programs, and for the ATCs, we also ensure that for discharge planning, we are setting up additional resources for that individual to go back in the community and continue to be successful and continue on their road for recovery.
Mm-hmm. I feel like I'm doing this in reverse. I want to back up even more again and go back to, we say ATCs, addiction treatment centers, and we're talking about the different services and things we can provide there. But really back at the ground level, we're talking about, there are facilities, we have buildings across the state of New York where people with substance use disorders or gambling disorders, it could be that they're battling with, alcohol, they can go to these facilities. This is where they can go and be treated, receive treatment, and then help once they've gone through the program to live in recovery afterwards. But how does that work? Because I know a lot of people may be wondering, okay, so what does that mean? There's a treatment center I can go to for services on this. I can be treated for this. What do I have to do? Do I go into like an apartment style setting for a month, 2 months, a week? I mean, give us the real basics on how this works. What could people expect?
Okay, so we're going to keep it, as you said, I'm going to use your terminology, basic. Let's keep it simple, because just walking through our door, we understand that that's hard enough. And being able to kind of break things down for an individual, not knowing what to expect, we understand that anxiety that can take place with that person, even making that first phone call or asking for help or so. So just the expectation-wise, we want to promote on this particular podcast just a level of comfortability, indicating that we value diversity. That's first and foremost. We welcome diversity. We welcome the community to come in, to even see our facility if that's a need to. Yes, we have particular rooms. It's not apartment style. We have rooms where it's shared rooms. Some ATCs do have single rooms, but for the most part, a lot of the ATCs are shared rooms. So you are sharing a room with another individual. We provide food. We provide clothing if needed. We have the meals. We have the snacks. We have the counseling aspect of the medical aspect at a certain extent. But all those pieces, I know that folks may think about, and like, why should I come to an ATC? The best answer, one of the best answers for that, is the quality services you will get from your counselor, and really, honestly, from when you walk through the door, you will feel that particular comfortability, and you will feel that you are, in many ways, wanted. And I really believe that from even myself as a director, being at admissions and welcoming individuals from 6:30 a.m. and 7 a.m. waiting at our front door, they understand when they walk through our door, they're going to feel comfortable, they're going to feel welcome, and they're going to have a level of understanding that we are going to be here to help them one way or another.
When you come to the ATC, the first thing that's off the table is insurance is completely off. Yes, we will access your insurance, but the most important thing when they come to the ATC is already having that burden gone, because whatever your length of stay needs to be and whatever services you need provided here and when you leave are looked at and being taken care of. But our facility at McPike, we have a 68-bed facility. We're about 46,000 square foot building. We're on the grounds of the psychiatric Mohawk Psychiatric Facility in Utica, New York. Mm-hmm. You do share a room, but you have very large psychoeducation groups that you'll be part of. We have smaller groups that you'll be part of. We go for walks. We have a nature program that is running right now, but the individuals who can fit into that program will work with that counselor. We do crafts as recreation for people to start easing their minds so they can start feeling normal again, whatever their definition of normal is, and just focusing on themselves. Some of the classes that we offer classes that look at feelings, at grief and loss, so they can start dealing with the anxiety of losing the things that they're going to lose when they go into recovery. We have coping skills classes. We do seeking safety. There's a lot of trauma-informed work that we do, and we also do the gambling treatment as well for individuals who have a co-occurring gambling diagnosis or gambling only, or an issue with gambling. They don't have to have a diagnosis. We offer those classes as well. So just being in the facility and having a 24-hour nursing staff to be able to deal with any type of issues that you may be dealing with, going through, not using the substance anymore and how your body feels. You can ask them questions. We provide complete medication coverage. So a lot of the medications that people could come in, whether you have, hepatitis C or HIV, those types of things, or those medications are expensive, we take care of that for you. So what we try to do is try to eliminate all those things that could be detriments to recovery, and start putting together treatment plans that we can focus on, what's going on inside of you, what's going on in with your addiction, and what are the barriers that could stop you from going into recovery. And we start breaking down the barriers for when you leave. There's a lot of talk about social determinants of health, working with community-based organizations when people are discharged, so that they can continue in the recovery. It could be something simple as setting up daycare services for your children, or connecting you to all the food banks in your area if you're struggling with that. We also offer here at McPike a financial group, talks about paying your bills and what it means to have a credit card and how to use that stuff, because those are some of the things that we don't think about that could be detriments and barriers to recovery. Right. Yeah. So from the McPike, you're going to get all that stuff, and every other ATC, you get the same stuff.
Yeah, and that is so important to point that out too, that it includes eliminating the barriers. I know that's something that we talk a lot about within the agency, because I think a lot of people don't realize the barriers that do exist there. So I think for people to know that, we're deconstructing those barriers to make their treatment and recovery possible. That's important. Thanks for pointing that out. And, Stephen, you mentioned you're in the Utica area. Vivek, did we mention where Kingsborough is located? We get that out there?
Actually, no. So Kingsborough is located in Brooklyn. So it's Bedford-Stuyvesant, Brooklyn. And we're at ATC that's not on the grounds of a psychiatric center. We are directly in the community, directly in Bedford-Stuyvesant, easily accessible to so many buses, so many trains. So yes, we do receive a lot of individuals who walk in because once again, we're that accessible to the community, which is perfectly fine. And we're also very accessible to about four different hospitals located pretty much in the vicinity of where we are as well.
Yeah, and so obviously we're talking to people right now from very different areas of New York State. And again, I just want to point out there are 12 total. We're talking to representatives from 2 of them right now. So there's so much that's offered. Another question I wanted to ask you too. I think a lot of people, when they think of treatment centers, they think of references to celebrities going into rehab, or they think of what they see on television or learn from Hollywood about treatment centers and that sort of thing. What do you both feel the biggest misconceptions are about treatment centers when somebody comes in, or just when people in the community? You said if people wanted to come out and see what the facility is like, they're welcome to do that. What do you think the biggest misconceptions are, and why do they exist?
We do make, do the best to make our environments calming and soothing. Here at McPike, we are working on a more of an enhanced mental health program. The services we're already offering, but adding some additional pieces to it, like a quiet room and those types of things to assist individuals. I think the misconception is that you're just going to go to a facility and hear the cascading falls, and then that's going to be okay, and you walk out and everything's done. And there's a lot of work that happens in the beginning of treatment when, we're providing the assessments and continuing assessing the patients while they're in group, while they're in individuals, in medical sessions, those types of things, to be able to identify completely and effectively the continuing care services that you're going to need from an individual standpoint. But it's just not sitting there and listening to that stuff. It's actually being, given some information and workable tools to be able to take and apply them to the individual's life, so they can enter recovery and be successful at it, regardless of what that looks like from a patient-centered perspective. So that to me is one of the biggest things when you watch TV and everything is like they went to IKEA and everything is picture perfect.
Right.
But there's a lot of work that needs to be done from a treatment standpoint by the facility itself and the individual when they come in.
I want to just stress exactly what Steve mentioned. He mentioned the part of doing the work. Here, working in a state facility, and I'm sure the sister programs, which is the 12 ATCs in various different communities in New York, can pretty much co-sign exactly what I'm mentioning. And we receive a lot of referrals from family members, from daughters, sons, husbands, whatever, who have gone to the treatment programs that you mentioned, the Malibus, Floridas, whatsoever, where they come back and they give us some insight as to their particular experiences. Now, I don't want to downgrade what their method is. So they have a particular method. All I can pretty much attest to is the methods of the ATCs. And the methods of the ATCs is pretty much providing that, like I mentioned, that individualized care and having our clientele understand that it is a journey. You will be involved in various different aspects of the program. We're here to help you along the way. We're here to educate you. We're here to bring out things that you possibly didn't know was affecting you, such as trauma or whatsoever. Steve mentioned having the quiet room. We have something here called our meditation garden that we have individuals go downstairs as well, to have that particular kind of experience or that time just to themselves. So we're continuously kind of evolving as well. So we are learning from the Malibus, of course, and we're bringing new things, and we're learning from the community, and we're hearing and we're getting insight and feedback from our clientele as to, well, what are their particular needs, and we're incorporating those kind of things into the program. So yes, there is a lot of misconception from what they see on TV and the sitting around and looking at waterfalls. Yeah. Yes, absolutely, because they don't show the hard work that's also needed, all those tools that are being provided. Sometimes assignments that they need to do, those actual true individual counseling sessions that are being done. So those are the pieces, those are the misconceptions. But ultimately, the work that is done at the ATCs are top notch, honestly. And that's why I mentioned, I have to stress that we do get individuals who have paid the $50,000, $60,000 over in the Malibus, the Floridas, or whatsoever, and they come to us and they are so appreciative at their completion to say, you know what? I really received the services that were needed to help me along and continue on my journey. Yeah.
And you talk about how great the services are that are provided, and the people that staff these ATCs. I mean, they really are top notch, and they work so hard, and they're passionate about helping people in their journey. And certainly that is so incredibly important. If someone is out there right now listening to us and they're saying, okay, you know what, I want to know more. How do I, either for myself or a loved one, how do I start that journey to get the information, to have someone get in that door and start doing that hard work you talked about? What's that first step?
Okay. It doesn't matter what language you speak, we can assist you. While Kingsborough we do have a monolingual Spanish-speaking program that everything is done in Spanish, along with our other programs. If you're looking for detox, inpatient rehab, you can walk in, you can call our admissions department, you can go on the OASAS website. Don't hesitate. If you're just curious and want to ask us questions, give us a call. Call our admissions department. You can call the directors, honestly, if you feel more comfortable in doing that. But don't hesitate. We don't mind answering your questions before you fully commit to walking through our door. We just want to give out the information and let everyone know we are here. We are here to provide services for you, quality services for you. And once again, don't hesitate to reach out.
Stephen?
And Jerry, I'm going to back up. You mentioned something about transportation, which is extremely important, especially because we get patients from all over the state. So it could be very critical to make sure the transportation is identified and they have access to transportation. We work with Medicaid cabs. We have our staff pick up individuals. We use Lyft and Uber. We use medical transportation if we have to. So those types of things, we could take care of all that as well. If someone's out there and they're worried about how am I going to get there if I live in a rural area or if I want to go to a different part of the state and I live in the city, what are some of the things that I can access to get me there? We'll get you here.
Yeah, that brings me back to what you said earlier about breaking down the barriers. That's another huge barrier for people sometimes, transportation. How do I get there? And again, as you just pointed out, helping to take apart those barriers and open that door to treatment and getting people into these programs. I know there's a lot more that happens at the treatment centers, and I feel like we need to have you guys back for another episode of the podcast to kind of dig more deeply into the services and such. But I think this was a great, first introduction to how people can get involved with treatment centers, what's provided there, and we want to help them start that journey. And I think you've both helped a lot of people do that today. So thank you so much. And you mentioned the website, oasas.ny.gov, oasas.ny.gov. Thank you both for sharing all the information you did today. Any other things you want to share about, in motivating somebody to get on that website or make that phone call before we wrap up?
So thank you again for having us. For those who are listening, community-based organizations or individual looking for treatment for a family member or for yourself, no need to hesitate. There's no judgment coming from the ATCs. We are truly here. And
thank you for having us. And I just want anybody who's listening and they're on the fence about coming to treatment, I just want to let you know that you're worth it.
That's an excellent message.
Visit oasas.ny.gov, that's oasas.ny.gov, then /Addiction Treatment Centers for more information. You can also go to our Hope line. That's available 24 hours a day, 7 days a week, 877-8-HOPE-NY.